Thank you very much for the opportunity to speak with you and to present my research. My name is Yaniv Zager, and I'm a colorectal surgery fellow from Advent Health Orlando, Florida. I will present a meta-analysis about the predictive value of post-neoadjuvant treatment MRI in rectal cancer patients. This is our disclosures. So rectal cancer is the third most common cancer in the States. It's the second most deadliest, and there is an epidemiological trend toward younger patients. We all know the last decade's evolution of rectal cancer treatment, the TME in the 80s, the neoadjuvant chemoradiation in the early 2000s, and then total neoadjuvant therapy and watch and wait regimen. During all this process, MRI has become the most common imaging modality for local staging and restaging. Our meta-analysis was aimed at collecting high-quality data, up-to-date data about the prediction value of post-MRI and actually pre-surgery MRI, the correlation of it with the actual post-op pathology. We aimed to include the patients that were treated in TNT fashion, which were not, there weren't reports in previous similar meta-analysis about including those patients. And also, again, to understand how much complete response patient we missed that could have avoided basically a rectal resection. We performed a meta-analysis based on the PRISMA 2020 guidelines. Two independent reviewers searched Google Scholar and PubMed, and then analysis was performed by open software. Starting with slightly more than 120 papers per search engine, we narrowed it to 30 papers. Some of the papers were reviews, some had non-relevant data or non-relevant analysis, duplication of data. Finished with 30 papers that reported of over 3,400 patients. Most of them were male patients. The median age was about 62 years, and most of the studies were retrospective. Most of the studies came from the US, Europe, and China. Our main results were that the accuracy of prediction by post-treatment MRI of the tumor restaging was about 64%. The accuracy or predictive value of MRI for nodal involvement was about 70%. And then the correlation between imaging complete response and actual pathological complete response was about 57%. And then the correlation between MRI circumferential resection margin and actual pathological CRM was about 75%. Our conclusions are that the concordance between the post-treatment MRI and actually the pre-operative MRI and the final pathology is limited and suboptimal, and therefore caregivers should take it into consideration while making decisions. The future aims of our meta-analysis is to compare different MRI protocols, to discuss the inter-observer agreement between the radiologists that read the MRI, to perform sub-analysis for TNT patients, although very few papers that actually present relevant results for TNT patients were published up to date, and then also to discuss the late contribution of AI and machine learning to maybe enhance the predictive value of post-treatment MRI. I will take any questions or comments now.